I visited the Glen School last month. That way on campus, I think. Yeah. Glen School, yeah. Just the campus here, just kind of like ease into the neighborhoods, or is there kind of a distinct? This is the.
Oh, so I was doing the sound check.
All right, can you hear me? So why is it doing that reverberation? That's Wi-Fi.
30. Okay, so we've got 30 folks online. We've got more than about 10 in the room. Okay. Good afternoon. We're going to go ahead and get started. My name is Anja Marie Hancock. I'm the Executive Director of the Kirwan Institute for the Study of Race and Ethnicity. And welcome again to this latest instance of our Kirwan Forum series. I have been having computer issues, which is why I could not print out Gary's extensive resume, but I am thrilled to welcome Dr. Gary Painter from the University of Cincinnati, who is going to be giving us a talk today. Gary is the inaugural holder of the BEARE Chair in Real Estate at the University of Cincinnati, and he directs their real estate center down there. Gary and I have known each other for almost, 16 or 17 years now. We were colleagues together at the University of Southern California, where he held a number of different positions, but head of the Saul Price Center for Social Innovation, also head of the Homelessness Policy Research Institute, which is a place where we did some collaborations in the past. He's a professor of economics by training, that has been in policy for most of his career, got his PhD at Berkeley. I am thrilled to be able to welcome him. He joined the University of Cincinnati about 6 months after I joined OSU. So one of my first invitations was to welcome Gary. So Gary, I'm going to turn it over to you.
Thank you. Really good to be here. And for those people online, I forgot to ask ahead of time if there was any way to manage like questions that are coming in online and so on and so forth. But all right, so you will do that for me. I am perfectly happy to stop for any questions that people have as I go. I don't know what the full culture is here in terms of when people give talks and kind of like maybe people just like power out the talk and then everybody asks questions. Happy to do it in any way that works for you today. I'm both really excited to be here, but also intimidated to be here because I'm coming to a space where most people in the room and online probably are true race and equity scholars. And I have done a lot of work where my work has important implications for race, equity, and outcomes. But I am not a race equity scholar. Fortunately, in my career, I've been able to learn next to people like Anja Marie, Lavana Lewis, and in my own school, and many, many others that are not, I can't name. And so to that end, I'm not a subject matter expert in the way that people hear. At the same time, as Anja Marie had noted, for the last, since 2015, I was the director of the Price Center for Social Innovation. And I'm going to spend about 2/3 of the talk talking a little bit about the field of social innovation. And in so doing, I hope that you can kind of think about connections between what is becoming a little more formalized as a field of social innovation and some of your own work, especially connecting to areas of social movements. Because I think you'll see a lot of overlaps there in really intriguing ways, yet they don't often, these fields often are operating separately from each other and sometimes don't even inform each other as I think they ought to. And then at the last third of the talk, I'm going to kind of talk about an application of using social innovation processes to address kind of racist practices within the homeless service system. And how the social innovation processes that we were building out in the Homelessness Policy Research Institute has made a particular set of progress around the goals that our community had. And I really appreciate seeing all the values up here on the wall. And I think values, you can't really talk about any kind of anti-racist practice change until you talk about what are our values to begin with. And so I think that's going to be part and parcel as we go here. Again, the field of social innovation, in my view, is started to become formalized around the turn of the millennium, where it's not that people weren't practicing what we can now call social innovation. It's just that people hadn't thought about it as a formal field of practice in social change that one could, in theory, activate if you wanted to participate in processes of social change, as opposed to maybe traditional processes through the political process and so forth. So. Is this the click on? Maybe. I could be hitting the wrong buttons. I can also just use the arrows.
Sometimes you just, if you click on the PowerPoint, it'll
okay.
clicker.
Got it. Oh,
Yeah,
perfect. So one of in my view, in order to understand the field of social innovation and when to activate it, and I'll define what it is momentarily, you have to ask questions of, well, why would you want to use social innovation as opposed to our own already democratic processes that exist for social change? And I'm gonna come back to these kind of two key concepts, is that we do have problems that are persistent. And so a picture of a homeless encampment under the 10 freeway in Los Angeles, which, you know, Aunt Marie and I probably go by quite often. And these broken encampments just continues to get bigger and bigger. And so the homelessness in Los Angeles has become a persistent and increasingly difficult problem to deal with, complex problem, et cetera. We think about issues of inequality. Inequality continues to get worse, not just in the US context, but in other countries, but certainly far worse in the US context. Now, some people might look at some of those issues and say, well, we have solutions. So we have housing first solutions to address homelessness. We have simple, and it's simple in a theoretical sense, tax changes we could do to reduce inequality, right? We could pass a wealth tax, we could kind of increase the marginal tax rate for people earning over $400,000. Like, these are not complicated conceptual problems, yet they continue to persist and get worse, actually. And so I'm going to argue that these social innovation processes might do something to build an infrastructure from which we can actually come up with solutions. In some cases, those solutions may not have been heard of before. In some cases, solutions aren't that different from where we may have engaged before. And then finally, I think social innovation processes can be really useful to address novel solutions. So I'm gonna, I guess, kind of go back and forth. I think the question that I've asked myself is, you know, from 2015 on is this one, which is, can you actually, if we're gonna use the word innovation, can you actually apply private sector innovation frameworks to social problems, to addressing social problems? Like, is that possible? Now, in some contexts, particularly in Europe, you'll have camps of schools of thought that many people kind of look at this question and go, well, of course not. That's just going to be one more neoliberal encroachment into how we think about things. So why would you ever even imagine private sector innovation frameworks being applied to social problems? You're just wrong from the start. You shouldn't even think about it. But on the other hand, we have seen innovation frameworks solve problems in the market. We have seen innovation frameworks solve problems that kind of intersect market and social outcomes. In particular, I had the picture with COVID there as an example of an innovation framework that was actually developed over 150 years to figure out, like, okay, if we have a need for innovation in the case of pharmaceuticals or drug, in this case, vaccines, what are we going to do about it? And so we knew worldwide what we could do about it. We actually deployed an innovation framework to solving that problem. And you might have seen, you know, in the private sector, this is just an example of the lean experimentation process. So the lean startup model, and you can see there's things in there: ideation, constituent discovery, building, testing, iterating, responding. All of those kinds of things, which in and of themselves are not necessarily a neoliberal encroachment into how we might want to do things, where values might be the preeminent kind of thing that we want to hold on to. But it does entail perhaps a different way of kind of uncovering solutions. It should entail like a different way. I think this is the most important part, is this kind of constant iteration within these systems is a very different kind of model than a political system typically is, where we have our, you know, midterm elections and our elections, and we're trying to build up slowly to get consensus and all those kinds of things. We wait for those policy windows and all of that. So that's kind of hopefully what we have in the back of our minds here today. But I still would argue, despite the fact that I am, you know, writing a book on social innovation right now, like an advocate for social innovation, I actually want us to be cautious of that, right? And so scholars of innovation, Klein and Rosenberg, I just found, you know, like the most cited article I could find on innovation. When they describe innovation, it doesn't really sound that neat and clean, right? They wanted to say right off the bat, like, these models, you know, they depict innovation as smooth, well-behaved, linear. These are badly misspecifying the nature and direction of causal factors. Innovation itself is complex, uncertain, disorderly, subject to changes of many sorts. Innovation is also difficult to measure, demands close coordination of adequate knowledge, market judgment to satisfy all of these different types of, I'm gonna say stakeholders in our context, potentially simultaneously, right? So if we're going to take a step into using innovation approaches to addressing social problems, then we need to be ready and comfortable with, to live with this. And so that's something that we have to also keep in the back of our mind. And then when we think about social innovation, it's a new field, a new way of imagining doing things in the social change world as many people think about it. Like I said, I think social movements have been using these tools for a long time, so it's not that new. But social innovation is not aligned with our current systems of political power. You know, the status quo bias is real, and so it's very much easier to kind of keep with the status quo if you can just test one little thing at a time. And so the risks are quite low, and so social innovation can be viewed as very risky. Nonprofits and social enterprises that have actually been following these approaches for numbers of years, decades, etc., sometimes are disconnected from systems of power. And so if, depending on what country you're in, but in the US context, we do actually have a culture, especially with philanthropy and nonprofits and social enterprises, of trying new things. But those new things don't necessarily get connected back to systems of power in any specific way because they were never connected to begin with, is one argument I would make. And so to do that, you actually might need to weave frameworks together in a much more intentional way. So, you know, pushing social innovation, if you were to push it, might just kind of be like throwing your head against the wall, like, you know, like, why am I gonna go this approach? But I would come back to that first slide and say, well, we ought to actually do this because these are persistent problems, they're complex, or there's new problems emerging. And our traditional systems just haven't been working. And you can have the long list here. Again, scholars in the room can have a much better, fuller literature review here. I just grabbed, cherry picked a few things, you know, political polarization. You know, most people would argue it's getting worse, harder to make decisions, harder to build consensus, so forth. Social fragmentation, where you don't actually interact with people outside of our bubbles as much as we used to, whether it's social bubbles, faith bubbles, economic bubbles, race ethnicity bubbles, nativity, immigrant bubble, like there's all sorts of bubbles that exist now. And then thinking about kind of how cross-sectoral solutions emerge, I think we actually had a somewhat Pollyannish way of talking about cross-sectoral solutions, you know, back in the 90s when I started my career. And we talked about like private-public partnerships, like if we can just do this, we can somehow come up with solutions that aren't there. In fact, a prominent social enterprise scholar, Santos, notes this. He says, you know, this is still in 2012, by the way, and again, so I'm sort of criticizing him, but this is the Pollyannish kind of view that I think is there, is that maybe what we can do is integrate across sectors because we can leverage the advantage of each sector. We can innovate and pilot through social enterprises. We can mobilize the political attention from grassroots protests, kind of the social movement side, and finally we can get funding from the public sector to promote change at scale. So every sector just does what they're best at. Then we can, you know, if we just kind of build that system out, then we can get the outcome that we hope for. And I just don't think we have evidence that it works quite that way. And that's why I think a new way of imagining kind of innovation frameworks applied to addressing social problems is definitely necessary. Did you have a question or you just had your?
No, I'm
just stretching out? Okay, that's all.
Yeah, stretching, I have seen that. Sorry.
Not a problem. So what is social innovation? How do I define it? And I could literally spend all of our time just talking about how this literature has evolved, how we should think about it. I'm not choosing to do that. I'm happy to kind of go down those rabbit trails if anybody wants to ask. So this is how I defined it with a couple of my colleagues, Christine Beckman, who is at USC still. She kind of joined in 2018, 19, something like that. And Giovanna Rosen was a postdoctoral scholar at the Price Center for Social Innovation. She's a professor at Rutgers right now. And what we kind of came up with was a definition that was focusing on the process by which innovations can emerge, as opposed to definitions that have focused on, well, what is a social innovation? And so again, like I said, there's all these debates about means and ends and how you can get to the outcomes you want. the way we define it is this iterative inclusive process that intends to generate more effective and just solutions to solve complex social problems. And where we kind of highlight in this definition in italics is that we do want iterative approaches. So going into an approach, we expect to, and I have an illustration on the next slide, kind of a step forward, a step back, step forward, a step back. Because every time we take a step forward, we're gonna learn something new, we take a step back to redesign, you know, that this sort of intentionality of iteration is critical. These processes ought to be inclusive, grounded in co-production, co-creation throughout the process, not just in the ideation, where does the idea come from stages where we take a moment to really deeply engage with community stakeholders, but we actually engage throughout the process of experimentation and scaling and diffusion in exactly that sort of inclusive way. And so some people, and this is, you see in the, just the broader fields of social change, political power, et cetera, people are building structures and systems that are going to include these co-productive elements. This is something that's not just living in social innovation. People recognize that we've been missing the boat for all sorts of reasons. Like the right ideas aren't even coming to the forefront because we're not approaching them in the right way. We're not going to the people that have them. We're not giving them power and so forth. But social innovation demands that this happens throughout the process, not just at the beginning. And that's where most of government, you know, kind of cross-sectoral governance approaches have sapped these processes to date. And then finally, I think about social innovation because it is this sort of risky, unwieldy process where we can't predict what's gonna happen. Like, I was like, let's not really apply this to every problem. Like, let's apply it only when we have a complex social problem, it's persistent, it's new, we need to act quickly. You know, I think about with the pandemic, like we had like massive learning loss, right? And that learning loss was not at all distributed evenly across, you know, the socioeconomic and racial and ethnic spectrum. Yet, we didn't really do any kind of innovative approach to address learning loss. We're like, well, you know, tutoring's gotta help, right? So we're like, okay, high dose tutoring, let's just do that, right? But then, as you thought about it, it's like, well, then the parents were like, well, how am I gonna get my kid to that place and to do that extra tutoring? And then they have like, it wasn't reimagined like into the kind of effective tool it could be, because it was just like, we're just gonna slap this on there. And I think it was really important to actually use an approach like this to uncover solutions rapidly, and iteratively to do that. And I say that there is a whole piece of the social innovation literature which focuses on what one set of authors, Marquez et al. Call complementary social innovations. So it's just that I'm kind of situating my conversation around social innovation around these bigger, complex social problems, persistent or new problems that are that you need to kind of bring a new way of thinking and approaches to, not just like process improvement, right? So people will talk about social innovation in government as we save the government money because we took the 73 Microsoft licenses and then we made it into one master license. Like that's social innovation. I'm like, yeah, I mean, it's innovation in the sense that you stopped wasting money that you shouldn't have been wasting, but it's not like what we're talking about here. It's not what I'm gonna talk about. So this is kind of my illustration for kind of how I think about social innovation. I think about stages of activity in social innovation. I know not everyone can probably see all the words inside the colors. I realize that now that I'm not at USC, I should change the colors. Yeah, this was branded USC colors, so I could probably change it to red and black, or some other generic colors. But I think what's most important about this graph is to note how many arrows are moving in what direction and what those arrows are. So most of the time when we think about something new, we're always thinking about you're gonna innovate, you're gonna move forward, you're gonna move forward, you're gonna move forward. And if you're counting arrows, even in this very simplified illustration, you would note that there are more arrows moving backwards, moving backwards, moving backwards. Why? Because of our orientation, and this is the word you can't see, is to learn, to learn, to learn. Like we are actually getting ready to learn whenever we try anything new, when a new idea emerges, or when we scale an idea and test it there, that our whole orientation is to learn, recognizing that we're not likely to uncover the solution on the first try. At the very least. So what we have is stages. I'll talk a little bit about co-production and piloting today. Someone can kind of also like flag me if I'm like vastly going over on time or whatever the case might be. And so we'll talk a little bit about some of these early stages where I and my colleagues at USC did most of our work at this stage. And then we'll, can certainly comment on kind of what the issues are around scaling and diffusion within the field of social innovation and outside the field. So this is the illustration. Just think about that kind of bias to moving back and learning, to pivoting back. That's the important part. So to talk a little bit about co-production or co-creation today, one of the things that I learned as I traveled Europe, I did a sabbatical in the fall of 2022, is that we don't, even though I could be in the UK, I don't speak the same English they speak. The scholars actually talk about these words in different ways, and I talk about them. If I use the word co-production in Europe, what they are assuming I'm referring to is that I am asking, for instance, in education, a parent to read with their child. That's co-production of education. It's where the user or someone associated with the user is actually producing that particular program, process, etc. And so co-production has not always the best connotation associated with this, like putting more work on the user of a service to actually deliver the service themselves. So I was shocked the first time I had my conversation with folks in Europe, and they're just like, what are you talking about? And I thought one time someone was literally gonna start, if they had had the vegetables, they could have been thrown because I was such a radical different way of talking about it. So I actually, used my sabbatical in Europe to go to a bunch of different countries to listen, to learn, because, it's not that we all have to speak exactly the same language when we're talking about these issues, but it's at least helpful to understand where they intersect. They, in Europe, will talk about co-creation as kind of the concept that I'm getting at with co-production. And that is just a really explicit kind of separation to say, like, the ideas have not been coming from people who are themselves the users of services, people within communities that have visions for how their community can build wealth and grow, etc. They've been excluded, and we, have many conversations about, all the examples of exclusion. So this co-production is saying that we need to understand, from the broadest perspectives, from the expertise that's in the room, from the learned expertise to the lived expertise, et cetera, et cetera. And then we can co-design pilots with this broad stakeholder participation that we're referring to. And then those ideas, those pilots are likely to look different than if we just had a room of learned experts talking to each other. So I don't think that part is controversial at all. What turned out to be controversial was the word co-production in Europe, but I have figured out, I think, how to navigate that a little bit and talk about that, and if we have time, we can kind of go into that a little bit further. I think the paper that I wrote with Devonna Rosen in 2019 kind of, and it's published in the Journal of American Planning Association, kind of talks about what we mean by co-production. It itself, putting within the context, especially co-production in social innovation, is talking about requiring stakeholders with different levels of economic and social power to learn how to share power. With service users, community members for the goal of community ownership, which then includes economic and social power. We wrote this paper in a special issue, which was celebrating the ladder of citizen participation from Sherry Arnett, that was written in 1969. And we're making the point that the linear conception of that ladder misses a lot of like how you actually get to kind of full citizen control, because unless you're iterating and building power along the way, you're not gonna actually get there. And so we've seen different models of this. Graham Beacus is, and I'm blanking on what country, some people might know where they are. They're a social enterprise. When they go into a community, they require 100% participation. It's like a unanimity or bust whenever they do something. So that is a very high threshold, but it also talk about once you have that kind of buy-in, you can get things done in ways that you would have never imagined before. We have many examples of when you don't do co-production. Some of them are comical in nature. Some of them are quite tragic. Urban renewal will be in the tragic category. To say the least, just thinking about where freeways were put is sufficient to think about one, tragic element of urban renewal. The world development policies, I love the story of the hippos, have people heard this story before? Okay, well, look it up sometime, but the short story is, the world development experts thought that, we're gonna teach these locals in Uganda how to farm. And they didn't understand why they weren't using this very fertile soil to grow these amazing, vegetables and so forth. And the end of the story is that once they were ripe, they became dinner for the folk, right? So the people who were there were like, well, this is why we don't put anything in here. It's because we will just eat anything we put there and eat, yes, it is better soil, but you just don't do it. So it's kind of like just this really stark example of lack of co-production. It's like the experts come in and go, okay, do something. So, in that kind of, I guess it was about 8 years or so after Price Center for Social Innovation, we had the opportunity to partner with quite a few collective action networks, collective impact initiatives. Some of them were tied to the Obama administration. So there was the Promise Zone Initiative, which, and all of these have like long backstories and I'm kind of rushing through them, but it was very intentional, that if communities, and there were 2 of these in Los Angeles, if communities had kind of proven that they had sufficient civic infrastructure to be kind of poised for change, what the federal government was going to do is to give them bonus points on federal dollars on applications for various kinds of programs and so on and so forth. They gave technical assistance, and then they often tried to work with, in our case, a university partner. In some cases, it was like a nonprofit evaluation firm, that sort of thing, to help those groups kind of create the futures for themselves that they want. And so clearly when Trump was elected, I remember I was actually at the Eisenhower building, like we're planning for President Clinton to get elected, and here's how we're gonna take the next steps. And a month later, those steps were not taken. And then in the Coachella Valley, which is in the eastern part of Riverside County, the Coachella Valley, for people in Ohio, probably might be a music festival or something. Or a place that sometimes people retire if they don't go to Florida. Or Arizona, like you have like the 3 choices, Palm Springs, Florida, or Arizona. So that's how people think about the Coachella Valley, but the Coachella Valley is, while it, 25% of the jobs are in accommodation, tourism, kind of leisure, et cetera. Almost as many jobs are actually in agriculture. And the community is very, just like a lot of Southern California is about 45% Latino. A lot of immigrants, a lot of people moving in and out, a lot of like inadequate housing, kind of what used to be mobile homes, but they're just kind of sitting there in 120 degrees in the summer without air conditioning. So it's a tough life for half the residents of the Coachella Valley, in particular, perhaps even more than that. So we worked with a group, we actually helped launch this nonprofit, which served as the backbone organization called Lift to Rise. And they've done some really cool things. They use this collective impact model, which some of you may have heard about. It requires someone to kind of manage the sets of stakeholders who are engaged on social change objectives. And you can read Kanye and Kramer's kind of like short version of what that can look like. And they really worked, kind of importantly, recognizing that political power had to be part of any solution. So they couldn't just like work in isolation as a nonprofit or a set of nonprofits, but they had to continuously engage the power in the state of California, locally, sort of more, you engage them more often because they're like, the Riverside County people, the cities, et cetera, and then federal power structures. In order to achieve the change objectives everybody in the room wanting to do. And they were successful at, with those political power connections, bringing in money. For instance, they received $15 million to build affordable housing. And they had objectives, as I said, the first initiative that came together, what people kind of focused on was we need to reduce housing cost burdens or rent burdens. And one of the pieces of that initiative was, we're gonna create 10,000 affordable housing units over the next 5 years. And they're well on their way. And throughout this, they were really flexible and iterating, like, what is the right structure to build and share power? And so, it was quite clear that one necessary but not sufficient element would be that you would want to bring in residents. Then how do you bring in residents of the Coachella Valley? Well, you give them a table that has work, but if you just give them a resident table that sits over here, where maybe someone is trying to communicate what the goals of the residents are to another group that's making decisions, then you're not actually building and sharing power. And this is something that's gonna come up in our example with Homelessness Policy Research Institute as well, is how to kind of take lived experience into power structures so that people with lived experience cannot just generate ideas, but also evaluate solutions to the problems in their own lives and or communities. So that was, you know, I probably, if I'm looking back in terms of actual policy outcomes adjusted like that, that's the thing that I'm most proud of, is that we were actually like a university research center was actually part of the creation of some, like, and so that made me want to spend the rest of my career, hopefully a long career, but actually figuring out like how can we make universities, how can we do authentic power sharing and partnership with communities? Not easy. Turns out, as many of you know, one reason I came to Ohio is we got a new dean, and one of the many things he did wrong, but this was one of them, was he's like, this is really hard to do contracts when you're working with lots of community groups, so we're just not gonna do that. I'm like, excuse me. You know, among other things, but I mean, these are the kinds, you can understand, right? It costs more money. And these are smaller contracts than if you go get an SF grant or something like that, right? So these are the kinds of pressures that you're gonna face internally and externally. I came to Cincinnati because the president there, the Office of the Research and so forth, like, we want to figure out how to do this. And so, well, I was like, well, that's where I wanna be. I wanna be a place where we figure out how to do this. Now it is a little bit of a culture shock, you know, that I went from public policy to a business school, I will admit. There are different student motivations I've experienced, we can talk about it first. I've had a few, you know, eye-opening moments from there. So that's co-production in the shortest possible way of talking. Piloting, I just want to say just a couple things about, because I do want to get to the example that kind of motivated kind of the, I guess, well, what I thought would be most useful for this audience. Okay. All right, so I'll move more quickly. So pilot to pivot, I might even skip this because I want to get to the example, but piloting, I do want to say a couple of things about it. I've talked to so many government officials that tell me how much they hate pilots. They just hate it. They recognize that we need to figure out new ways to do things, but they hate pilots. And for a long time, I just struggled with that, you know, kind of paradox. But when you kind of figured out why they hated it, it's not at all, you know, like you would also hate it if that's how you spent your life trying anything new. And I think this is important. Like, pilots often don't have clear goals and objectives. They don't have clear learning frameworks from which to kind of take that learning into redesign. So that's one important aspect. Pilots often take as long as full-scale program changes. Meaning that if you're only gonna do 20 people because you don't want to risk it, so to speak, but then it's still gonna take you 4 years to implement, right? This little pilot. And then you only have, the last point, you only have 20 people. So any evidence that comes out of that pilot is you just lacking rigor, which means that you know, depending on which side you were in terms of whether you thought this was a good idea or not, you're not gonna be convinced by the pilot one way or the other. It's like, well, give me rigorous, right? How many times have we heard that in public policy? We have to have evidence-based policy making. We need to have rigorous evidence, and then they have a particular, you know, idea in mind of how that rigorous evidence needs to be deployed or gathered. So those things are really, really important. My argument is that we don't think about piloting properly. We don't separate in our own minds, like, kind of like what I would call early innovation pilots, when you might have 5, 10, 20 people and try to learn as quickly as possible. This is again getting to that private sector model of lean experimentation. You know, like you jump into a pilot to learn. You don't like spend years, literally, as many of us who worked in social change at all have done, just coming up with the first idea to try, where we get agreement to try one thing. He's like, we're never gonna get perfect agreement, so let's just start trying things and then learn that. So my preferred analogy, and again, we can return to that in Q&A, is to think about how clinical drug trials have evolved. What happens in these different phases? Again, there's these structures. You have a phase 1 trial where you have very few participants. The goals are to make sure that the drug doesn't have any really terrible adverse side effects, or that it doesn't, it at least does some, like that you hypothesize. But then there's this kind of phase 2 trial, where you're studying efficacy, you're tracking side effects, you have a few more people, you still don't have enough population to look at randomized control trials and so forth, which shows up in phase 3. The reality is that in these phases, less than 30% move forward, they go backwards. So the expectation in this framework is that you're gonna go to readers, even if you get from phase 1 to phase 2 to phase 3. So that's kind of what I have in mind there. So let me jump ahead to the example that we had in mind. So we know, so first some terms, and these are the definitions that I'm going to be using. There's probably other definitions there, but anti-racism being defined by Kendi, defined as the opposite of racist, actively recognizing racism and seeking to undo inequities that are produced by it. So I'm going to use that definition, and I'm going to use the definition by a group advanced by Race Forward, which says that anti-racism is facilitated with the definition of equity that seeks not only equitable outcomes, but also equitable processes produce those outcomes. And I think that's a really important part of what I have in mind here. So we looked at a system around homelessness. We've done, a lot of analysis, not the first. I'm looking at LA specifically. And if you wanted to point to what are the 3 reasons that you see more and more people experiencing homelessness, it's, you can rank these in different ways, but like you can't address homelessness without addressing all 3 of these in LA. You can in Ohio, by the way, the housing supply issue is not as big of an issue.
That's not true, it's like Ohio.
It's becoming an issue.
Yeah, it's
Right, it's becoming an issue, but it's not yet that issue. It's like, in Ohio, when I talked to folks, I was like, let's not do what we did there. Because when I got there in the 90s, we're like, this is becoming an issue. And we did literally nothing but make the issue work for 30 years. Then you're out of luck. Right, so in any case, the relevant piece for this conversation was not the housing supply and the increasing cost burden and so forth, but instead issues of institutional racism. And as Anne-Marie knows, the continuum of care there launched a committee called the Ad Hoc Committee for Black People Experiencing Homelessness, which did, I think, I've never seen a committee like do such a good job of going deep and clearly identifying both kind of the causes and consequences, and actually put out recommendations that if you implement them, you would see substantive change, right? And that was just a really powerful, exciting process. The Homelessness Policy Research Institute was launched in 2017 with the Price Center for Social Innovation as kind of like the backbone organization. And the goal was to connect policymakers, practitioners, people with lived expertise, and researchers, importantly, who hadn't been connected, to really, focus on all the issues that were there. But to think about these issues without thinking about institutional racism clearly, and what we might do about it, even in our own routine, was a problem. And so we didn't want to have that problem. So we're like, okay, well, what do we do about it? So what we had in mind is that we need to bring race equity frameworks to any of the research that we're going to be doing. There are frameworks in this room, you probably know of them much more than I know of them, but whenever you apply them to a new space or in a different context, they need to be kind of catered to that particular context. So we brought in people with research, policy, practice, and expertise. We had values, such as in the room, like we're going to center on Black and brown voices, or whether you're in any of those stakeholder groups, but we're going to center on Black and brown voices. Our goal, as I said, was to develop this race equity framework, and we're going to do it through a collective impact action network model, kind of these social innovation kind of processes. So that's kind of how we stepped into it, with the values, the goals, and methods, knowing that we don't know, like, exactly how we're getting to that goal was completely unknown. There were early challenges anticipated because of power imbalances, especially the trauma that exists among people with lived experience and expertise. We weren't sure if, a university professor and someone who had been experiencing homelessness for the last few years sitting in the room together, how that would kind of work, how it should work. how do you, make sure that the expertise that both of them might have are brought to the questions in the way that is going to be not re-traumatizing for someone who's experienced trauma, at the same time also, we can learn together so that we can reduce trauma writ large in the system. And so what we first did in our kind of processes is we developed a race equity committee. And we implemented these values, and what we found out before we could even begin thinking about what is the race equity framework, we actually spent a lot of work developing a shared language, a shared history, a shared culture, so that we could even begin to do some of the things we had hoped to do, which was to change how we conduct and learn from research to address homelessness. Once again, that line, like in this room, you're kind of like, well, obviously, you can't get anywhere without that, but it's not something that not everybody who was in the room in the stakeholder group thought that we should spend 1.5 years on this issue. Because that's 1.5 years, and the issue is so huge, we can't waste our time, so to speak, and I'm saying that facetiously, but like, that's how people feel, right? And so what we ended up doing in this process, because of that commitment to shared culture, we had people with lived experience kind of first come to the homelessness policy research institute as members of the race equity committee, a place that they certainly felt more comfortable, where power was shared in ways that were much more effective. Then from that point, that evolved to be members of the research committee. Then evolving to becoming, our one of our co-leaders in HFPRI is someone with lived experience herself. Now we have members of the steering committee with lived experience. The process is moving toward like where we want to go. We still don't know exactly where it will end. I think one of the things that we have confronted is our goal was a race equity framework for research. And we thought we would come up with a template or a how-to, and that we could then distribute that and train people in the how-to. But now we're beginning to think it's perhaps more about a set of processes and values, and not a how-to in the same way, right? So that was a kind of like a revelation that, again, we made sure if we had read the right stuff before, had the right, learned experts in the room, maybe we would have come to it more quickly. But I think doing that together created much more time into that process. And these questions of power sharing, what roles do different stakeholders have and what decisions? And I have these in quotes because you may have heard all of these phrases before. Right, we need to hear from people with lived experience too. We need to center the voices of people with lived experience too. We need to be led by people with lived experience. That one's so much less. Right, but we're pretty comfortable with the social. Let's hear. Right, we need to center. Okay, more and more people are leaning that way, but what about being led by? That's where we may go. And so again, this work in my first slide, I had noted my two co-authors, Salomon Line, who is the managing director of HPRI, and Victoria Ciudad-Real, who is she was working with the Price Center for Social Innovation, and now is in her second year as a PhD student in sociology at Irvine. So excited to promote her, and maybe someday she can apply for a job here at Lewis. All right, so at the end of the day, do I think social innovation is needed to address homelessness? Yes, it is a complex, wicked problem. Racism is one of the causes that interacts with all these other risk factors. It can hamper interventions, and it can prevent us from finding true solutions. And I believe that these social innovation processes, because they are iterative and inclusive, committed to addressing the complex problem, are one path forward. So with that, I will stop and see if folks have questions.
Traditionally, Gary, how we do this is we'll do one in the room, then we'll go to one online and just kind of alternate back.
Sounds good.
Okay, any questions in the room? Go ahead.
Hi, my name is Jordan Linson-Cox. I'm the new Associate Director of Research for Kerwin. So first of all, thank you for your presentation. This is not a framework that I had any experience with, but I feel like it echoes a lot of frameworks that I have experience with. And so it was really interesting hearing different kind of methodological approaches to kind of these wicked problems. And so I had like two kind of large questions. One question, I think you mentioned, that a lot of these kind of iterative, or communal practices, are practices that already kind of often have been used by marginalized communities, but are now kind of being, more recently, taken by academic communities in order, like realizing the kind of efficacy of these structures. And so, I guess my first question is, what is the plan, I guess, for integrating things like Black, queer, Latino or Latinx radical traditions, in kind of understanding, how to employ these frameworks and how to actually prepare, like even like Paulo Freire, like pedagogy of press, how to prepare stakeholders, for kind of integration into these kind of multi-stakeholder contexts or processes. And then how do they work also on international contexts? Because all of my research is in international context. And when you talked about the World Bank, I was like, yes, this kind of top-down approach often doesn't work, but preparing stakeholders outside of these radical traditions that already occurred can kind of be difficult, to make things legible. So yeah, that's kind of a two-part question.
Well, it's a very good two-part question, and I may start down one part and not quite finish the second, so please follow up. I mean, I think that you said, what are the plans for integration across these potential fields that see a lot of alignment but have not been written in such a way? I know that myself and other practitioners in social innovation are welcoming like ways we can rethink how these in kind of these traditions do intersect. Because in some ways, this, like putting up that one illustration of iteration and all of that is fine. But like each one of those steps and the ways that you learn and the ways that you innovate are going to be tied deeply to the context from which you're operating in and what your eventual goals might be. And so I don't think just having this framework, if this is a framework that can be applied broadly, which I think it can in its proper context and construct and understood, it does need to be informed by multiple traditions, because when you're talking about co-creation or co-production in the authentic way that I'm kind of advancing, you're not going to get to it without that kind of deep understanding. So for me, I've had the most kind of, like, I would say, like intellectually and also kind of practitioners kind of stimulating exercises when I have got out of my comfort zone and gone into spaces, like I said today, it's intimidating for me, the level of knowledge that everyone has in the room around race equity compared to my knowledge, but trained as an economist, like I know, well, that training is useful in its context and so forth, but like, I think we have to make those bridges. And because there's just different people operating in different scales that think about and talk about things differently. So the plan, I'm open for the plan. Others are open for the plan. I know we had talked a lot about like the intersection between social movements and social innovation, how to really write and talk about that in a much more formal way. But as we know in the academy, these literatures, just sort of, they sit in different places. And so it could be instructive. And that's what I tried to do in publishing in different places like urban planning and management. And, just like kind of like, hey, these frameworks are maybe align well with things that are already happening there. Your question around kind of the international context, what was it similar and tied to that?
Yeah, so I'm just thinking about the fact that this is the same problem kind of exists in international context, which is the kind of divergence between kind of group mobilization. So like my experiences with the institutional analysis development framework. And so that often gets critiqued for the same, like a similar thing, which is that there's this whole post-colonial literature about development and about innovation, but it doesn't often get like connected back up to these kind of broader structures. And so, how does this then again work in an international framework, that kind of bridging between local, but also, as you're kind of saying, the silo of knowledge in the international context, I think also happens.
Yeah, thank you for clarifying, because one thing that I didn't spend too much time on at all is like how social innovation operates within the institutional context that it might be brought forward. Which I think is really important to kind of situate. In some ways, social innovation has been a field that's thrived much more outside the US or other developed economies. Why? Because some of the social problems that are being experienced in those places are already just part of typical government practice. You know, like public health, you know, sanitation, those kinds of things, right? But to your point, I have talked to a lot of people who are social, you know, are running social enterprises in the developing world, and they're like, well, we can do all this in this context and we can apply these frameworks in the way that, you know, you're talking about. But I can never get, the government just kind of like looks at you and go, well, we don't have enough money, or we don't have enough power to implement any of that, so it just doesn't even happen. And so I think what we're working on in the US context is gonna be a different set of things that what is gonna be working on in the world context. There's actually, though, as I said, more social innovation kind of thinking, working, happening internationally than in the US. Just because the institutional environment is lacking in so many different places that there's a lot more people working with these processes in mind. But you're right, that connection to government, we had a social social entrepreneur in residence at USC who was just like, I kind of quit being a social entrepreneur because like he was working in education in Liberia. He was just like, I got this far and there was no path forward. He got discouraged. Online?
There are no questions
Okay.
on the Zoom yet.
All right, back to the room.
Any questions in the room? I have a question, I will ask, since there isn't a pressing one from someone else. I wanted to ask you a question about, the iterative process learning. I'm just wondering if you could get into a little bit of the example of how the HBRI actually functions now to manage and mitigate power, because I know that folks may not understand, like, just all the different stakeholders that are represented, like, when we have a committee meeting or when we have an institute-wide meeting, how we think about questions. And some of those, like, I know it's a meeting and people are like, oh, it's just a meeting, how do you, but I think there are things that you all do that really do manage those power differentials in an important way.
Yeah, I mean, I think the thing that probably was most, just to kind of be surprising for those of us who come from the academic tradition, is that the meeting, starting in the race equity committee and then kind of permeating out to the research committee, we actually show that, for instance, as this is one of our values, this is what well-being is about. We can't even talk about research without showing the intersection. We use that exact one, right? And so for that, like, again, me as a researcher coming up and I have to publish a paper, and like, it's just so, you know, marching in. Anyway, I'm gonna spend 15 minutes on that value or on that value. And so the fact that we're spending that time to kind of orient the meeting so that people who have specifically experienced trauma can actually even get to the same place as someone else who doesn't, it has like, you know, in our profession, we kind of like, you know, like, I don't know, put up the walls and just like, okay, I can just do research, I can think about these things and so forth, because when we may have in personal life experienced trauma, we, you know, figured out how to still operate within that context, right? And so that is probably the biggest example of that change. And, you know, some people attend less now from the academic world than we had before. Others are like, wow, this is new. I've never been in a space where we're talking about critical research, and I'm actually can enter it in a way that is trauma-informed, well-being oriented, and with equity in the front of our minds. And it was not, again, overnight. So we did a lot of our experimentation within the Race Equity Committee first, as it relates to integrating these practices. And you mentioned like the broad set of stakeholders, like we have people who are in county and city government. You know, we have people who are researchers, we have people who are leading large nonprofit organizations, who are and small ones who are really on the everyday on the front lines of helping people experiencing homelessness. And then we also have people with lived expertise who have become a part and as I noted, like now part of our steering committee at HBRI.
So I'm curious, you know, you said you've had some faculty aren't engaged as much anymore, and the process seems very slow, which doesn't really align with the pace of the university.
Mhm.
And I'm curious if the people, like if you see more people with tenure
Mhm.
staying in this because they can, and they have the luxury of not having as much pressure, or if you're attracting younger faculty who are more interested in this kind of work, and how do they handle the challenge of the pressure to publish and the pressure to meet their requirements?
It's a fair question. It is true, if I think about my own life, I felt more comfortable engaging at post tenure.
Mhm.
But at the same time, we see, and to be quite honest, in the mid-90s, like thinking about even doing this sort of practice wasn't even on the table. Like I didn't know, I knew nobody that was saying this is how we should approach a research committee. Right, so it wasn't even like an idea to consider, but now it is, and I think people are trying to do that, and as you hinted at, young people in the profession are actually very excited about these practices and how that can be part of their research. And the challenge to navigate, you know, and hopefully folks, you know, who are a little more senior can help with that mentoring and so forth, is like, where do you publish? What are the ways that you engage when you might look at a particular piece of time, half hour in the day, 1 hour in the day, where it's not giving you a deliverable that's leading to writing your next paper. You know, so that kind of, you know, just the, you know, you talked about colonialism, like the colonial culture, sometimes people call it the white supremacy culture, but it's just kind of like what is the outcome, and the outcome being measured in a particular narrow sort of way. So there is that tension, but I'm seeing more young people like saying, I want to be part of it. They may not know how to be part of it, given these other constraints. And then there are people like myself and others who are more senior that can say, you know what, we can actually take the risks to, like, I don't know how this is gonna turn out. Right, and I might not get a paper out of any of this, like, I guess in a whole 5 years, you know, and it's like, 5 years. You know, like, come on, like, and in one's career in the scope of things, like, but the outcome, if we can learn something to how to practice evolve, it's worth it, right? So yeah, there's probably more excitement among the young folks, more flexibility among those tenured professors, and then how do we work together to forge this future?
Thank you.
Yeah,
Tony Collins, CEO for the YMCA of Central Ohio, says RY supports over 1,200 people daily in the shelter and supportive housing in Columbus. He asks, are you able to share any examples of communities in the US that are currently using this process to address system challenges?
well, I don't know if I know for sure, from Tony what he means by, like, what part of the process, but let me just answer it this way and begin. Certainly Los Angeles is committed to doing these sets of processes. And if you just look at the number of people experiencing homelessness, you'll say that our commitment to these processes is, if that's your outcome, is failing. But that's because there were 3 key drivers to homelessness. There was institutional racism, housing supply, and rent burden, and the other 2 just are like a tidal wave that are overwhelming everything. So there are places that are more integrated just structurally. So in Allegheny County, by accident of how that government was organized, you know, they have like so many of the health and human services integrated with homeless services and so forth. So they've actually, by construction, been able to do better to identify, I think importantly, like risk factors before they lead to adverse outcomes. And so that's an example where they worked with the community, they worked within their own systems using, you know, data analytic tools and also community-based interactions in order to identify and intervene in ways that are effective. I think that I don't know the ecosystem in Central Ohio. My suspicion is it's probably similar to Cincinnati, you know, in some ways, but it's fragmented. Right, it's fragmented. The economic development or the Jobs Ohio kinds of work that's happening on the economic side is just not connected at all to social services directly, is not connected to homeless services. And so in that context, that fragmentation is preventing lots of possibilities. And in fact, beyond some work that I know is happening, in King County, in Washington, in Portland, in Los Angeles, I mentioned Allegheny. There's fewer examples than I wish of like this sort of deep and integrated kind of commitment to things. Houston has gotten a lot of attention, like, look how we've solved our homelessness crisis. I don't know if you've probably read about it in Ohio. What they did is they just started implementing, well-known solutions, housing first solutions. They had vacancy, they moved people into units. Ta-da, like in that context, that's what you needed to do. But now that they are themselves a region starting to face some of these other challenges, they built a communication infrastructure, but not a deep integrated kind of stakeholder based infrastructure that we decided. I mean, the problem in LA is it's just so big, we have to throw out a lot of what we were doing before and have to reimagine the future in order to get to where we need to go.
Another question online maybe right now?
There is one.
Okay, because I had a follow-up, but maybe you could also talk about, for Tony, you know how Eric Rice was working on the triage tool
Yeah.
and just kind of how HBRI played, I think, a really important role in helping that triage tool. I mean, obviously, Eric is brilliant and it was his
Yeah.
kind of like contract with LASA, but he used that communal space to get lots of feedback and to improve that triage tool forward. So that, to your point about like not being so fragmented and not having a table or a place to convene such a multi-sector, multi-stakeholder context.
I mean, in a place like Los Angeles where the problem is so overwhelming, it's hard to know even where to begin.
Right.
And so what this community was able to do is just to look at, the advice from the ad hoc committee, which focused on a couple of specific recommendations. One of which was exactly what you were saying. It's like the way that we're assessing vulnerability may have some implicit bias. The way we assess vulnerability at that time in Los Angeles was because we have a system which was based on severe scarcity, we only have enough housing resources for the very worst situations, which meant if you were expected to die in the next 6 months, if you were living on the streets, then you get prioritized. And what we saw within that assessment of vulnerability, number one, the way people, especially Black people, talked about their vulnerability was not entering into the data system in the same way as a white person expressing vulnerability. And just even the questions themselves, the interactions with the caseworkers, all of those kinds of things led to a lack of transfer of what vulnerability a person possessed and the actual housing resource that may have been offered. Right, and so what we were able to do as a community in HPRI was to first kind of uplift, like, what is it gonna take to address that recommendation from the ad hoc committee for Black people experiencing homelessness in this context? We were able to go to funders and say, it's gonna cost $1.5 million to do this, right? And, their first offer was a couple $100,000, let's just throw a little money at it. I was like, no, we were able to, because we had built those deep stakeholder engagement, we were able to say, like, if you wanna do it, it's gonna cost 1.5. And so I could sit in the room and communicate that on behalf of the group, in part because that 1.5 million was coming.
Right.
So that. And then we were able to kind of do a sort of standard kind of RFP process in the way of like, we had 7 teams, incredibly diverse teams from all over. In some cases, we had some people from Australia who were, were part of teams that were there, like, to actually say, we want to be part of the solution. And so then the next step was, well, what are the spaces? I think that was your second point. Like, okay, we began the project, a team was selected, which included researchers from USC and UCLA, Eric Rice being at the social work school at USC. But many at UCLA and also other stakeholders. And we were able to kind of then say, okay, in order for you to learn about this, you need a forum to do that. And so the people who were engaged with lived expertise within the systems that in HPRI were able to be part of that, like, uncovering around these issues of questions not being well aligned, among many other things. There were issues of like the vulnerability assessment had something like 30+ questions, only of which 8, they, after a lot of research, found were really that useful. And so why ask someone 38 questions when you can ask them 8 and get to almost the same point, when the most important thing was the fact that on the 38, they weren't even actually delivering their kind of own personal assessment of their vulnerability to the person who's taking in the data. So it was a really important project, and now they're in the process of implementing those changes. But yeah, building out that infrastructure that has big benefits down the road, but to get to it was, kind of years of the making. Yeah.
I have, I think, kind of an ignorant, ill-informed, and awkward question to ask, but I have a reason for it, and I'll get to that in a second. But that is, what institutional racism is there that exacerbates the homelessness, or is one of the driving factors, I think, with your terminology? Fully understand the institutional racism, whether it be exclusionary zoning or the lingering aspects of redlining, and the clearly institutional racism of mortgage and financial institutions and purchase contracts rather than mortgages and so forth. But the reason I'm asking the question is, back in the 70s, I was general counsel for the National Coalition for the Homeless. And when I first came on, I was going to bring all these lawsuits based upon the 14th Amendment, because it turned out, back in the 70s now, but in virtually every community we went into, whether it be Detroit, New York City, Newark, Jersey City, etc., Washington, D.C. even, African Americans constituted less than 5% of the homeless. And there are probably reasons for that, but so certainly any institutional racism that exists today probably existed then. And because I'm just trying to figure out what other, I didn't fully understand the happening. For the reasons I said, it's harder for it's always been harder for African Americans to build up wealth in their homes and so forth because of exclusionary zoning and redlining and so forth. But is there something else that's driving homelessness in the Black and brown communities?
Something else, it's true that like rent burden is the issue, which includes both having incomes that are too low or moving slower than house prices and rents and that sort of thing. So that, again, it's an overwhelming factor in Los Angeles. But I don't like I don't know what the situation was in the 70s. You understand it better. So what we observe now in the data is that compared to the Black population's representation in the overall population, roughly, let's just make easy numbers, 10%. The number of the percentage of the homeless population that's Black has ranged from 30 to 40%. For Native populations, it approaches kind of 6 times overrepresentation. So that is a different, sounds like, outcome, if you will, than what you saw in the 70s. But what we did see in the early 2010s was exactly that outcome among the Latino population, where the Latino population was much less represented among the homeless population than their overall population. And so one could have argued, well, then I guess there's no institutional racism for Latino immigrants, right, or something like that, right? And I don't think people would have argued that, but it was just a fact. And I think the story there is one of, which is often true, that in communities where you have lower levels of income, but there are strong community support networks, they will work until those kind of networks actually get so strained that the whole network breaks. And so I don't know the process from the 70s to 2010 as it relates to the African American population, but this conversation that we just had about the tool itself to assess vulnerability is an example within the homeless service system of kind of how our implicit bias about how the tool would operate in all populations operated for the white population where it was designed, didn't operate in lots of other marginalized populations. So that was an example where even within the homeless service system, we had that. And then these other outside factors, discrimination in the housing market, discrimination in the labor market, they just exasperate the risk factors. factors, discrimination and, you know, like arrest rates, et cetera, et cetera. So I don't know if that answers your question.
Well, yeah, and actually, even though you put your finger on exactly one of the reasons in the seventies was the African American church. So I did a great job of supporting families who were on the verge of or were homeless. And until it broke, and the number just got so big that the church as an institution couldn't do it, so.
Well, I think in a lot of rural areas with really high rural poverty, my family background is from Appalachia, Kentucky. And so in those communities, which I know well, which are all, you know, 98% white, you know, kind of communities. There's a lot of, if you transferred how you're living to LA, we would call that homeless. You know, like, in terms of like what electricity is hooked up or not hooked up, you know, like my wife first visited with me, she's in Papa's house down there, she was just kind of like. Like, I mean, she was from Holland, Michigan, it's not like she was in like this ritzy place that she had come out of or anything like that, but it was just like, this is crazy, you know, but there, like, it was kind of like, you know, like my aunt and uncle, like, they would just drive up sometimes, it's like, can I just park in your, you know, front yard and live for a while? Like, sure. You can come in, you can use the facilities and whatever, they might, you know.
And nobody thought anybody was homeless.
Yeah, yeah, so there's some of that happening with just kind of like we, instead of, like our processes are about measuring like this particular outcome of homelessness as defined by HUD, et cetera, right? But housing vulnerability is this continuum, and like, if we're thinking about addressing it, we have to think about like, yes, over here, how can we prevent the vulnerability before it becomes homelessness? So we see in immigrant populations all the time, overcrowding, doubling up and so forth. It's still part of the network supporting each other. But then what we've seen in LA is that eventually the conditions were such that that network, you were no longer sleeping in, and on the floor, you were sleeping in your car outside. And then people and families were taking turns sleeping in cars, but that person sleeping in the car is considered by definition homeless.
Jordan, you're gonna be our final question.
No, I was just gonna kind of add on to the conversation. I'm coming from Mississippi. And a big issue in Mississippi is kind of like what the definitions by HUD are of homelessness versus what housing insecurity often looks like.
Right.
Which also is substandard housing conditions. That people are living in that are unsustainable, and multiple families living in spaces, et cetera. And so a big issue is like getting city stakeholders to view those kinds of insecurities as legible enough to make interventions. And it seems kind of impossible to get those stakeholders to use the same language as people who are housing insecure or people who are advocating for housing insecure. And so I think on that end, trying to build those coalitions and spaces, or using these frameworks in order to build coalitions in these spaces that are more kind of threatening, or less kind of accepting of people's lived experiences, I think would be really interesting, like how that would operate in a space like, you know, rural Mississippi.
Right.
Yeah.
Thank you.
Please join me in thanking Dr. Gary. The next Kerwin Forum Series will be on March 28th. Myself, Dr. Gary Segura, and Dr. Ray Sonnenschein will be presenting on the Los Angeles Governance Reform Project, looking at corruption and ethics reform and redistricting / gerrymandering. So even though we're talking about LA, once again, it's applicable to the state of Ohio. So join us then. Thank you.
Sorry, something you might want to look into, it seems that the National Museum of African American History and Culture recently actually held a Descendant Community Social Intervention Lab.
Okay.
In order to, I'm thinking, sort of like a basic theory, kind of think through Descendant.
This is the one.
Yeah, what is a descendant? There's like a lot of